If you're a sexually active person, or even if you're not right now, you no doubt have questions about your sexual health. Like, should I be tested for STIs? Which ones? Or what are my options for preventing pregnancy? You might have some questions about your libido and why it's so low or high and whether that's normal, or why sex is so painful or getting an erection is difficult. It's not always easy to bring these topics up, and it may not be clear exactly what questions you should be asking about your sexual health. So, how do you overcome your own hesitancy or embarrassment and start that conversation with your healthcare provider? That's what we're talking about today on this episode of ASHA's Sex+Health podcast. To help us out with this conversation, we have two sexual health experts, Martha Kempner and Logan Levkoff. Martha has over 20 years of experience as a sexuality educator and writer. She writes about sexual behavior, contraceptive, STDs, and is the co author with Pepper Schwartz of the book 50 Great Myths of Human Sexuality. She also writes the weekly newsletter Sex on Wednesday, a must read for sex educators, parents trying to raise sexually healthy kids, and anyone who just wants to know what's going on in sex. You can subscribe to Sex on Wednesday on Substack. Logan is an ASEX certified sex educator and internationally recognized expert on sexuality and relationships who has appeared on The Today Show, The Rachel Ray Show, Oprah, and CNN. She was also the sexuality expert for the first 3 seasons of the A&E series Married at First Sight. Logan is the author of several books, including Got Teens, The Dr. Mom's Guide to Sexuality, Social Media, and Other Adolescent Realities with Dr. Jennifer Wilder, and How to Get Your Wife to Have Sex with You. We are thrilled to have Logan and Martha with us today to help us learn how to get over our embarrassment and start the conversation with our healthcare providers and make sure we are getting the care that we need. So welcome, Logan and Martha. Thank you so much for being here today. I think to get us started, maybe we can talk about why it's so difficult to bring up questions about sexual health with our providers.
Thank you for having us. Why is it so difficult? I mean, why is it so difficult talking about sex in general? And it's that we don't have a lot of great role models showing us how to engage in these conversations first and foremost. I actually want to just start with a story just to show you that even in our sexuality professional world, we are surrounded by friends and family members who don't always do the things that we tell them to do when it comes to talking to doctors and providers. So years ago, and the contraceptive method might give the time frame away, I was having lunch with a friend of mine who had just had her annual gynecological appointment. And we were sitting at lunch, and she said to me, Logan, I need to talk to you about something. My diaphragm really bothers me while I'm having sex. And I looked at her and said, wait, I'm sorry. You're asking me this? Did you not just come from the doctor who was the person who fit you for that diaphragm? And she looked at me deadpan and said, I don't talk to my doctor about my sex life. And it occurred to me, and it occurs to me over and over again as these things keep happening, that we separate parts of our body from our sexual health or sexuality. And that's a real problem, right? Because I mean, I could give my friends suggestions about her diaphragm, but I am not the person who's going to solve that problem. So I think it's just puts an exclamation point on even when it has to do with parts of our body that are involved in sex of any and all kinds, we still have lots of challenges.
I think it's funny because I think it combines two different things. We don't do a great job talking about sex ever, right? That's one of the taboo subjects that we've kind of been trained to just not talk about in public. And I think we're all maybe a little afraid of doctors. Or, I mean, I know that I go to the doctor kind of thinking of it like a test that I have to pass. Like I'm waiting for them to tell me I did something wrong this year or, but I think we also don't know how to talk. It's especially hard to talk to someone who we think of in a more formal light. And so that's where I think it's this crossover between being uncomfortable saying words like penis and vulva and itch and ouch and, and my diaphragm hurts. And you're right, that does give it away because I don't think anyone uses a diaphragm anymore. But so I think it's all of those things together. But also with this idea of we're a little intimidated by doctors to begin with.
Yeah. I think you raised a really good point. We can be intimidated, and I think also we and maybe I'm just talking about myself, like I want my doctors to think I'm doing well, right? We go in there wanting to be praised in some way, and so if we have a sexual health concern, oftentimes we're afraid to bring that up because we're afraid of some kind of judgment from that medical provider. And look, I think that you and I clearly agree on this, but in no way, shape, or form should our medical providers be judgy when it comes to how we choose to express ourselves, how we choose to or don't choose to share our bodies with another person.
But they are.
That's a non-starter.
Sometimes they are. And I think that that's the other thing that we need to talk about today is how do you talk to your doctor about these issues is one question. And then the next question is, what do you do if you don't like your doctor's response? Because I think one of the things that we do forget about doctors is that we're their customers. Yeah. Right? Like, yes, they know a lot of stuff. They know more than us. They know more than you about fitting a diaphragm. But at the same time, we actually are hiring them to do something for us. And if they are judgy, or if they make us feel extra uncomfortable when we kind of build up the courage to do this, then we are completely within our right. And it's the right thing to do to find another doctor who, you would feel better about saying, hey, by the way, something's off.
Yeah, very much so. I think that one of the other challenges in talking to medical providers is that we often think that our sexual concerns, particularly as they relate to pleasure and function, we actually think that they're not connected to this big word health, right? We think it's something that's an other or a taboo or not a legitimate concern, when actually pleasure and function are important parts of our overall sexual health and well-being, and certainly a huge part of our overall health. And so as patients, as consumers, as human beings, we need to first and foremost recognize that we are entitled to sexual function and pleasure, and that is a part of health, right? We have the right to speak up about those things and to have our concerns or questions answered.
Right. And that's the other thing, is to really have them listening, right? To make sure that your doctor is listening to your concerns. Do you have an idea, Logan, for us on the first question you would ask?
I think that there's so many questions. Sorry, I just saw that. So the questions to ask a doctor. Well, here's the interesting piece of this, is that technically, right, our doctor should be opening the door for us, which Absolutely. I think is why it's a hard question to answer. I mean, ideally, in a perfect world, our doctors say to us, what would you like me to know about your sexuality or your sexual life so that I can best take care of you? I mean,
how satisfied are you? Let me ask you a question. Have you ever had a doctor do that? Because I have not.
I mean, I have to say, I actually think now I do. Now I have some really good providers, but part of that might also be because I've made what I do for a living. I've had these conversations so openly that I think they know that's what I expect from them. Like, that's an important thing. I mean, look, I am definitely the patient who recognizes when there is a new brand of speculum sitting on the counter, right? That is me, and I am clearly not the average person, which is probably a good thing for a lot of providers, that I'm not the norm. But I mean, they should be opening the door. But one thing I would say is that it's not so much the questions we have, but in how to comfortably ask them. So, I don't expect that everyone is going to be comfortable saying, I used to have more of a drive or libido or whatever word you want to call it, and now I'm feeling a little off. Like, I get that that's not a comfortable thing. So oftentimes I will recommend to people that write a list of all of your questions down. Anything pertaining to something that feels off, feels good, feels different, smells unusual, whatever that change is. Write it all down and make sure you take that piece of paper into your appointment with you. And even if you never look up from the page, say, I have some questions I've thought about in advance. May I ask them? And then read through them, right? And hopefully your provider responds in a way that is thoughtful and kind and recognizes that, it's not enough to just say, okay, everything looks okay, I'm moving on to the next person. Do you have any questions that you think like come to mind immediately?
I think the questions that we ask are very different at different stages of life, right?
Yeah.
So I think that there were definitely a time in my life where I had some questions about STIs. I know from the profession, from the professional work that I've always done, that STI testing isn't actually standard, right? You go in, even when you're going into a gynecological visit, you go in and they don't necessarily test you for everything. You have to ask. So that those were questions I had maybe maybe earlier in my life when people were using diaphragm still. I think, but I those questions changed. There was definitely a period in my life when I had questions about getting pregnant and why was it taking so long. And then there's definitely questions about um, I've I've certainly had some symptoms over the years that are a little bit like, wait, what's going on? So I think it really depends, and um, I think maybe it can be so simple as saying, I really would like to talk to you about my sex life for a minute. And maybe, hopefully, with that prompting, the healthcare provider will then say, "Oh, that's a really important topic. What can I help you with?" And let them shoulder some of the awkwardness of this conversation. But I think the other thing to remember is you can be casual about it. You don't, you can be like, um, I have a symptom that I want to talk to you about, and open the conversation that way. Or I'm really wondering about this. And just, I think whenever you read the guides to, how to talk to your doctor about sex, the questions feel so awkward on paper, like nobody talks like that. But so you can just, try to make it more of a dialogue.
Yeah, or yeah, I'm a big believer in owning that awkwardness, and to even say to your doctor, I have this issue I want to bring up to you, and it feels really
Yeah.
awkward, but but I want to tell you. And at least that's also the cue to your provider to be thoughtful and sensitive, because this isn't something that you're comfortable disclosing. But awkwardness is okay. Like I think that we've become a culture, a world that's really afraid of being awkward, because awkward seems to have a negative connotation. Where to me, awkwardness and getting past awkwardness signifies, resilience and strength and cautious risk taking.
And you're
And
wearing a paper gown. So everything's going to be awkward when you're wearing a paper gown. So maybe just, embrace it, as you said.
Right, but I would say this. One of the things that I do when I've taught the medical community is, these are conversations. If you want to take sexual histories, if you want to have questions about someone's sexual life, they should be dressed, right? I mean,
Yes,
like, remember the power, the perceived power
absolutely.
balance, and make sure that your patient does not
Especially,
feel extra vulnerable.
especially the first time you meet a physician. The first time you meet a physician, you should absolutely, or any kind of healthcare provider, you should absolutely have your clothes on, and during the introductions. And I've actually, fired or just not gone back to physicians who don't have that practice, because I just don't think it really does. It starts you off on very unequal footing.
That makes sense. Martha, going back just a little bit to talking to your provider about STI testing, how would someone who's going to have that conversation for the first time know that it is the right time to have that conversation, or what exactly they should be asking for?
So it's not your job to know what exactly you should be asking for. That's the big thing. If you are sexually active, um, and you think you have any risk of STIs, there is absolutely no reason not to get tested. So when you go to your provider, you say, I think I should be tested for STIs, and their job is to figure out what STIs you should be tested for. They should ask you questions about your sexual history at that point, and they should figure it out. But don't go in, and I think this is a mistake we make in a lot of different ways. I know I do this. Don't go in thinking you have to tell them the problem and the solution, right? Your job is to tell them what's going on. Their job is to tell you what to do next.
I've also heard some stories, particularly in working with teenagers, that I've had some students who have gone into offices saying, I would like to be tested for sexually transmitted infections. And their response, the medical response, has been, oh, you don't need to. I mean, that to me is also a sign that perhaps you want a new provider, right? I mean,
Absolutely.
this is we want people of any and all ages to be responsible, to take their sexual health into their own hands and to say, I want to make smart decisions. And it's really not just about like what I've done or what my partners have done in the past. It's about me right this moment moving forward. And I know how to make smart decisions, and I'm committed to doing that. So I would also say never let someone talk you out of something as important as a test because they don't think it's important for you. You can trust your gut.
Definitely. And I think the other thing that happens with teenagers, as I said, it's kind of a stage of life thing, but I think sometimes teenagers and young adults aren't taken seriously for a lot of different reasons. And I think we as parents in particular have to train them to advocate for themselves. And I think, some doctors are more comfortable with teenagers being sexually active than others. But again, it's not their place to judge. This is not what they're there for. They're there to provide the tests, to provide the contraceptions, to help teenagers decide what methods are right for them. And so, yeah, I mean, I think I would hope that I have teenagers now. I would hope that anyone that my kids went to see wasn't judgy. But unfortunately, sometimes it is. So one of the things that we should do as parents is help them advocate for themselves, or be open and honest and go with them.
Go with them and then leave the room.
Absolutely.
Go with them
Absolutely.
and then leave the room. And by the way, for anyone who's going to be listening to this, I think that's particularly if you typically go into a room with someone else, it is a really good practice early on, particularly on that pubescent cusp, to start saying, I am going to leave the room for a little bit so that if you have any questions about the experiences you're having or what might be coming, next for you, you can develop that relationship with your provider. And I would encourage medical providers to do the same thing. Like, at some point, ask me to leave, please. let this relationship start to develop. Not every young person wants to be examined in front of the grown-up in their life and certainly doesn't want to share certain things or questions. And they deserve that respect and privacy as well.
Yes, I'm kicked out of the room all the time. I'm not allowed in.
Absolutely.
It's weird as a parent, but it's absolutely the right thing.
Yes, very, very much so.
Yeah. So why do you think that these conversations aren't being brought up by providers a lot of the times?
So that's the why question behind why providers aren't talking about these things has been this long debate for as long as I've been in this field. And there has been study after study, 2012, 2016, 2018, 2021, all showing how patients really want their doctors to bring up issues of sexual health and sexuality with them. Right. And there seems to be a barrier there. Some of that is institutional, which is that sex ed yes, certainly for the 10-minute, everything you need to learn about someone's health and medical history in 10 minutes, but institutional in a sense that most med schools don't give the sexuality education and training that providers are going to need. And that's everything from conversations about gender and identity and expression to language not just around gender but sexual orientation, to things like navigating the health and boundaries and discussions of consent of people who, not just everyone, but people who also are part of the kink community. There are so many things that doctors really need to know and understand in order to best connect and gather information from patients, and they don't always get it. There may be a few electives, but there are not a lot of them. And that means that it becomes a doctor's responsibility to get continuing education. And even when they want to, it may not be easy to do so. So I think that's a major a major barrier, time and also lack of education in this space.
And I think, we can go back to our very first question. Why is it hard for us to talk about it? Because sex is a taboo topic. Why is it hard for a doctor to talk about it? Because sex is a taboo topic. Doctors are human, and you don't, walk into a meeting with your accountant and say, so, do you have any issues with your sex life? And I think it's hard. And as Logan said, because it's hard, they need specific training to do it, and they're not getting that training. And so, it's easy. I think between that and the pressure that they have to see patients quickly, it's an easy thing to forget. It's an easy thing to gloss over and to just, hope it doesn't come up this time. And obviously it's so important. It has so many different ways in which it can affect our health that, we hope that medical schools will start really talking about it, for one thing, and that doctors will start. I mean, I think, again, in this two-way relationship, the more we talk to doctors about it, the more they're going to start talking to us. The more doctors talk to us, we really have to break down those barriers at both levels.
Yeah, and look, people make lots of assumptions, and I think the one of the biggest ones that comes to mind immediately is even the assumptions people make about disability and chronic illness and sexual pleasure and function and people's sexual lives, right? Though even if you're working with people who have disabilities or chronic illness, I mean, it is important to talk about sex and sexuality and pleasure still. But we do this thing where we think that if someone has a particular issue, then that's their only issue, and then sex must be not important to them. And look, we all have a sexuality from birth to death. We express and explore differently throughout our lives, but it is not a switch that just gets turned on or off if other things are going on in our lives. And it's an important reminder for everyone that, if you feel like your medical needs, your intellectual medical needs are not being met, you're not getting the services you need, and you bring it up and they're still not being met, then Martha is absolutely right that, we are still consumers, and we have the opportunity and ability to go elsewhere, to find a provider that respects us and meets us where we are.
So a question that we get asked a lot is, what does it mean to be sexually healthy? What does it mean to start advocating for these things? I know that's a loaded question, but if you can just kind of kick us off a little bit.
I think we both spent a lot of time writing some definitions of sexual health. I think what's really important to remember is, and this is true of all health, it's not just about not being sick, right? So that's the biggest one, is it's about, and you have to, I would say, kind of come up with it for yourself, but it's about feeling good sexually, being able to experience pleasure if you want it, not experiencing pain when you're having sex. Because I think a lot of people, especially people with vaginas, are used to the idea that sex might hurt, that any penetrative sex might hurt, and that's okay. And we just kind of have to put up with it. And that's not true. Sex really isn't supposed to hurt. So we should really, if that's happening, that's something to get looked at. But more than that, you should be able to have desire. You should be able to have pleasure. It's not just that nothing itches or burns right now. It's that everything is kind of going along swimmingly. And if it's not, that's when you want to bring it up.
Yeah, and I see sexual health as something that can be specific to the individual, right? The things we do to take care of our bodies, our minds, the information we have access to, all of that is personal sexual health. But then there are all these other big issues that impact our ability to be sexually healthy, right? Which is the quality and the dynamics of the partnerships we might be in. Cultural messaging around sex and sexuality, even politics, right? Like, at the end of the day, regardless of whether or not you have any say in it, policies get made that impact people's ability to be sexually healthy. So all of those things together make defining sexual health really complicated, because it's not just about preventing the negative, right? It's about how do we create a holistic experience where someone individually, personally, within relationships and in the world that they live in, feels empowered in their, to be who they are.
Yeah, I think you bring up a really good point about within your relationships. I think so often people start talking about, advocating for their own sexual health, figuring out how to navigate that with a new partner, old partner, whatever it might be. I think that's a piece that people also struggle to start those conversations as well.
Very much so. I mean, and not just, have you ever had an STI? Have you ever been tested? Those conversations. So I'm hoping that in a post-COVID world, we've developed the scripts, right, for testing and risk behaviors, whether masks like condoms or just when's the last time you were tested, right? I think that I'm hoping if there's a silver lining to any of this, it's that we've gotten very used to using that language about testing and risk, and that we will start to be able to put those conversations into sexual health conversations, and not just speak without judgment, but also listen to someone's answer without judgment. I think we've gotten some good practice in the last 2 years, so maybe something good will come from that.
And I think you were actually starting, forgive me if I'm putting words in your mouth, but I think you were actually starting to say it's not, I agree with you that we've gotten some good practice and I hope it kicks in, but I also think it's going beyond that, right? It's not, it's more about what, what feels good, what do you like? And all of this has to do with sexual health, because you guys, when you're in a relationship, as Logan says, I love her phrase, when you're sharing your body with someone, their health and your health are together in a way, especially, both emotional and physical.
Yeah, very, very much so. And even when we talk about, how to have healthy relationships, even recognizing that the word relationship means different things to different people, right? And I think that part of being a sexually healthy person, in quotation marks, means, talking about what type of relationship that you want, right? And for some people, that's monogamous. For some people, that's not monogamous. Whatever it means to you, people have to feel like they're entitled to speak up for what they want and recognize that it might not work for the other person. And that's okay, right? I mean, particularly working with teenagers, I've spent a lot of time on this word rejection. Like, rejection is a human experience that we have all of the time, right? We are told no. I would imagine most people are told no at least once a day, let alone like thousands of times throughout their lives. But that's okay. And that's part of becoming a human being, is to navigate when things don't always go our way.
Yeah, that makes a lot of sense. So kind of going back to the provider a little bit. So if you've identified that your provider isn't asking the right questions or they're not answering the questions you need, how would you recommend someone go about finding a new provider?
Well, can I say something here, because I want to be not judgy? I've been telling people that I'm going to fire my gynecologist for like 5 years now. She was great when I was pregnant and having babies, but basically at this point, we're down to the fact that she spends I'd say she spends 12 minutes with them and 8 of them is telling me I need to lose weight. And so very judgy. I don't think she's asked one question about my sex life. I don't think she's asked one question really even about, my mental health, even like throughout the pandemic, where I feel like everyone is starting questions with, how are you? Like, really, how are you doing? I don't think we've had any of that. And I haven't done anything about it. And I am very lucky to have, pretty high quality health insurance that gives me access to a lot of providers. So before, I just want to put it out there, because I want to make sure people don't feel like we're being judgy about the fact that you might not have, walked away from a provider who wasn't giving you what they want. It's a pain in the butt. It's really difficult. You have to find someone new to connect, and you have to, start over, hopefully with your clothes on. I think, the access issue is very different for everyone. And it's very, unfortunately, in this country, it is very dependent on what kind of healthcare you have. I think the most the way to start is probably to start looking at a list of providers who take your health insurance, or clinics that take your health insurance, or Planned Parenthood affiliates in your area that will offer services on a sliding fee. But once you do that, I find that the best way to do it is recommendations from friends. So, and if, so, hey, these are the three, put out a message. You could do this on social media. You could text a few of your friends, your neighbors. There's about 4 Facebook groups in my town where people are constantly posting these messages. These are the 3 doctors on my, who accept my insurance. Does anyone have a personal experience with them? I've even very specifically had people say, hey, I'm tired of being weight shamed by my gynecologist. Does anyone have a gynecologist who doesn't talk about your weight? And I've taken notes on those threads and still haven't actually changed my gynecologist.
Well, if that doctor's listening now, I think they might get the message.
Maybe. And I mean, that is one of the other things that, Logan was talking about education. There isn't a great feedback loop, right? There isn't a great, if I change gynecologists, unless she's listening to this conversation, it's very likely that she'll never have any idea why, and therefore won't have changed her practice at all. And so I think that's one of the things. And I'm not, taking it to the next level and saying that if your doctor doesn't do what you want, you should absolutely, write a review right there on the spot. That's a lot of work. But what I am saying is just, I think that in terms of the system, it's a little bit broken for improvement.
Sure. Yeah. I mean, I would agree with all of those things. And I would also say that, for me, Google is sometimes my friend. And so, I look at names when I get them, and I'll do a little search and see like what if any provider has been quoted in the media, in what subject, what is their area of expertise? What are they saying? Do their values when they speak, the language that they use, does it feel like it's aligned with my values? That's the one thing I think that we forget, is that having the internet, and I'm by no means suggesting it's always good, but it does give us opportunities to do some research that maybe we wouldn't have been able to do 20, 30 years ago, unless you were reading a magazine like Prevention and saw someone's name pop up, right? Like it's different now. So we should use all of the tools available to us. So if you're getting names, start looking them up. That is absolutely, I mean, that's more than you're right. That's it's a great tool we have, so we might as well use it. And you'll see very quickly, like if someone's expertise is in something that's relating to you personally, then that might be someone, what, I'm gonna reach out to that person if they, they fit my, what I need from a doctor financially or within insurance or whatever it might be. This is an opportunity. This is someone you might want to check in with.
That's actually a really good point. I had to find an endocrinologist recently. And I was looking, so the medical group that I go to is like one of those big practices that has tons of specialties all under, one roof. So I was looking through the names, and one of the women, and I admit I look at pictures. I know that that's totally, never judge a book by its cover, but she had a very friendly face. And she said in her profile that she specialized in gender affirmation treatment for trans kids. And I was like, okay, we have the same values. This is fabulous. And I absolutely loved her.
Yeah.
I had a great first meeting with her. So I think, just looking at little things, little triggers like that, little clues that you might like them, and opinions of people who've seen them. And there's also lots of pages for reviews online. I think one thing I would say about reviews is that you like with restaurants, you only get the people who loved them and the people who hated them. So you got to take it a little bit with a grain of salt.
Right.
Yeah, exactly. So what other advice would you have for someone who's listening to this podcast, who's starting to ask some of these questions?
I think that I don't want that. Well, that's such a big question. There's so many things I would want people to know. I think the first thing is there is no one correct way to be a sexual being, right? There is not one model, one path that someone needs to be on personally or interpersonally in order to be considered like a good sexual being. So that's the first piece of it. And feeling, part of feeling sexually healthy starts with feeling good about who you are and knowing that whoever you are and however you identify and express yourself, you have the right to be treated with respect and valued, and have your concerns and questions answered by someone. That you are perfect. That sounds so cheesy. I'm not going to say what I was thinking, but like you have
just the way you are.
Yeah, I mean, something like that. But right, that you deserve to be connected to professionals who see you for who you are and who you want to be, and and help you with that, whatever that means to you.
I would add,
cheesy, I'm sorry.
I would add that going to the doctor is vulnerable. It's vulnerable for a lot of reasons, right? One is you're in a situation very purposefully where someone knows more than you, which always makes us feel a little vulnerable. Two is the part of being naked and all of your all of your body kind of out there. There's, as I brought up before, there's issues of weight and self-esteem that go into this, both being naked, being weighed. And then there's issues of like, as Logan said, I want them to tell me that I did a good job, right? I want them to tell me that I was a good girl this year. And so I think we've definitely all been kind of raised with that feeling. So it's very vulnerable to be there. I'm going back to the paper gown because it just makes so much noise when you're sitting there. It's such a strange concept. And so allow yourself to be vulnerable, I guess, is where I'm going with this advice, which is just acknowledge that, but say, this is one of those situations where it is okay to be vulnerable, because if I try to know everything, or if I try to hide things from my doctor, I'm not going to get the care that I need. So go in with the questions. You don't have to go in with the answers, but go in with the questions and the honesty. And then, then we'll talk later about whether they handled the questions and the honesty correctly or with respect. But you got to take that vulnerability leap to have the right relationship.
And I would say that if any providers in any category happen to be listening, I think that, this idea of having a sexual history doesn't need to be everything all at once, right? And it's something that should be a model that starts when we're young, when we get a sense of, tell me your name, tell me who you are, tell me what pronouns you use. Let's have this be an ongoing relationship so that I can best serve you. And it's not that I ask these questions of just the people who I think look like they fit a certain mold. I ask these of everyone, right? So I'm not asking you to stand out differently from someone else. These are questions that are important for everyone. So I think that's a first piece of it. I think recognizing that you might be surprised by your patients, like don't make any assumptions about them, about whether it's identity or sexual orientation or relationship status or disability or pleasure, like be open-minded to hear from them. And I think also recognize that you might not have all of the information as a provider. So, develop some resource lists, partner with other people in the sexual health community so that if you don't have the time to answer everyone's questions, hand them a list of resources, have a website available so that you are still helping them along this journey, even if you're not the one specifically disseminating, the particular information.
And I would add to that, if we're talking directly to providers, hopefully they are listening, educate yourself. I know, just as an example, that the pediatrician's office that I take my children to closed for a whole day to do education around being gender affirming for all of the providers and the staff. And I think that's fabulous, right? I think knowing that they're going to be dealing with patients who are questioning their gender or transitioning genders, with young patients. And it's okay as a provider. Here's vulnerability for a provider. It's okay that you don't know exactly what to say right now, but it is your job to educate yourself and to educate your staff and the people who you're working with, so that they can then have the right words to use, the right procedures to use with patients. And some of that is so simple, like more than one box or more than two boxes on your form about gender, right? It's pretty easy to make people more comfortable. You just have to take the steps to do it.
Great. And one just final question to wrap us up. For someone wanting to learn more, what are some resources that you would recommend?
Wanting to learn more about talking to your doctor?
I would say about both starting to talk to your doctor, but also someone who's kind of coming across the idea of sexual health and wanting to kind of learn more.
That's a good question.
It's a big question. So
maybe
because I think, the thing is that it depends who you are and what you're looking for. I think there's a lot of great information out there on Planned Parenthood has a great sites even like WebMD and Very Well have good articles. There was a great article on WebMD yesterday about how even female doctors are take longer to get diagnosed than men because women are often dismissed when they have symptoms, and that it even happens to female doctors. So there are things out there on sources like that. I think, the problem is that you're going to end up taking the good with the bad. There's some articles out there where I, look at it and I'm like, could I rewrite this? Could you just, I wouldn't say that. So Logan, I don't know if you had any more specific advice, but I do think there is a lot of information out there.
Yeah, I think there's great information depending on what you're looking for and and what stage of life that you're in. I mean, ASHA obviously has good information. And if you are a young person, younger than in your 20s, kids,
or a parent,
or I was going to say that our parents or guardians, or educators, even working with young people. Amaze.org has some incredible information run through, advocates for youth. There is a lot out there. The one thing I would say to anyone who's searching the internet for information, find out, what is the organization that's putting out this information? Who is the author? Who's writing it? Is there a particular agenda? Like if you search that person's name, would, some horrible things come up? Like, do a little bit of research. And that's the problem, right? I mean, we need to constantly fact check because there's a lot out there that is, let's say, maybe not deliberately incorrect, but sometimes deliberately incorrect. So you can find great information, but we have to be responsible for doing a little digging as well.
Great. Well, thank you both so much for being with us today. This has been a wonderful and super informative conversation. And thank you to everyone who's listening to this episode of the podcast. For more episodes and other resources, you can be sure to check out www.ashasexualhealth.org. Thanks and have a great day.